the nose and paranasal sinuses. First, the nose can be divided into two parts. The outer part, which is called the external nose, which is pyramidal in shape, and an inner part that is called the nasal cavity. The nasal cavity. Both of them, the external nose and the nasal cavity, are separated in the midline by what we call the nasal septum. First, the external nose. The external nose, as we said, it is a pyramidal shape. It has a framework that is formed by cartilage and bone. It has a free end that is called the apex of the nose, and it has a root that is called the root of the nose that is formed by the frontal bone and the nasal bone. And it has two elliptical openings that is called nostrils. These nostrils, as we said, it is separated from each other by nasal septum, and it has a lateral border that is called ala of the nose. The framework of the external nose is made of above is formed by bone and below is formed by cartilage. Above is formed by the two nasal bone by the frontal processes of the maxilla and the nasal part of the frontal bone. Below is formed by plates of hyaline cartilage. The external nose has two elliptical orifices or opening that is called the nostrils. These are the two elliptical opening or orifices. They are called nostrils. As we said, the nasal septum separate the two nostrils. The ala nasi, this is what we call the lateral margin, is rounded and mobile and contain fibro-fatty tissue. So the external nose has two elliptical orifices called nostrils, separated from each other by nasal septum, and it have a rounded lateral margin that is mobile. It is called ala nasi. The nerve supply of the external nose is derived from branches of the ophthalmic and maxillary division of trigeminal nerve. Branches of ophthalmic nerve اللي هو V1, these are the infratrochlear nerve and the external nasal nerve. These are branches of the ophthalmic nerve, V1. Branch of maxillary nerve اللي هو V2 is the infraorbital nerve. These branches will supply the external nose. The blood supply of the external nose is derived from branches of the ophthalmic artery, branches of maxillary artery, and branches of facial artery. Branches of the facial artery will give a branch that is called superior labial artery that give a branch which is called septal branch of superior labial that supply the septum of the external nose. Branches of maxillary artery, which is the infraorbital artery, and the branches of ophthalmic artery like that of the external nasal branch of anterior ethmoidal, and another branches of the ophthalmic artery. The nasal cavity is divided into two halves, as we said, by a nasal septum into right and left half. Each nasal cavity have a roof, floor, lateral wall, and medial wall. The medial wall is formed by the nasal septum. First, the nasal cavity, it extends from the nostrils, the elliptical opening in front, to the posterior nasal apertures, or that is called choanae. Here, the choanae will lead into the nasopharynx. Nasal vestibule. The nasal vestibule is the area of the nasal cavity lying just inside the nosotrils. The nasal septum is made of cartilage and bone. This is the septal cartilage, the perpendicular plate or the vertical plate of ethmoid, completed by the vomer bone from below. So the nasal septum is made of cartilage and bone. These are the walls of the nasal cavity. As we said, it have a roof that is formed by the perpendicular plate of ethmoid, middle, and it have a floor formed by the hard palate, and it have a lateral wall, and it have a medial wall that is formed by the nasal septum. First, the roof anteriorly is formed by the nasal bone and the frontal bone. In the middle, the roof is formed by the cribriform plate of ethmoid located beneath the anterior cranial fossa, and posteriorly it is formed by the downsloping body of the sphenoid bone. So this is the roof of the nasal cavity that is formed anteriorly by the nasal and the frontal bone, in the middle by the cribriform plate of ethmoid, and posteriorly by this downsloping body of the sphenoid bone. This is the roof of nasal cavity. The floor, here we can see this is the floor of the nasal cavity, is formed by the hard palate. As we know, the hard palate is formed anteriorly by the palatine process of maxilla, posteriorly by the horizontal plate of the palatine bone. The lateral wall, this is an important wall. Why? Because it has a 3 projection of bones. These 3 projections of bone called superior, middle, and inferior nasal concha, or another name turbinate. These bony projection will increase the surface area of the nasal cavity. Below each concha there is a space، يعني هناك فراغ تحت كل concha. This space below each concha is called meatus. So we have superior meatus. The space below the superior concha is called superior meatus, and we have a middle meatus, and we have inferior meatus. All these structures are in the lateral wall of nasal cavity. So we have a superior meatus, we have superior concha, middle concha, and inferior concha. And below each one we have a meatus or opening. Superior meatus, middle meatus, and inferior meatus. The superior meatus will receive the opening of the posterior ethmoid air sinus. The middle meatus, higher opening, it will receive the opening of the maxillary sinus and the frontal sinus and anterior ethmoidal sinus, while the inferior meatus will receive the opening of the nasolacrimal duct. Here, the features of the middle meatus. When we remove the superior middle concha, we will find what we call the bulla ethmoidalis. Bulla ethmoidalis is a rounded swelling that is formed by the middle ethmoid air sinuses. This middle ethmoid air sinuses will open on the upper border of the bulla. إذن هذه أول feature, the first feature that we will find when you remove the middle concha. We will find this rounded swelling that is called bulla ethmoidalis اللي هي تمثل لي middle ethmoid air sinus. Below the bulla ethmoidalis there is what we call the hiatus semilunaris. Hiatus semilunaris is a curved opening that is just below the bulla. What is the benefit of the hiatus semilunaris? At the anterior end of the hiatus semilunaris, it will lead into a funnel-shaped channel that is called the infundibulum. which is continuous with the frontal sinus. إذن يعني راح يكون frontal sinus will lead into the infundibulum that open at the anterior end of the hiatus semilunaris. Maxillary sinus opens into the middle meatus through the hiatus semilunaris. Here we are removing the middle meatus. We are removing the middle concha, exposing the hiatus semilunaris اللي هو هذا قلنا curved opening. Here this is the what we call the bulla. هذا هو rounded swelling that is called bulla ethmoidalis. اللي يمثل لي الميدل ethmoid air sinus والopening of middle ethmoid air sinus on the bulla. Here the curved opening below the bulla is called hiatus semilunaris. Its anterior end is called infundibulum, that it will lead into the frontal sinus. So the opening of the maxillary sinus also into the hiatus semilunaris. Here this is the small superior concha, and below we have the superior meatus that receive the opening of the posterior ethmoid cells. The sphenoid sinus will open into the sphenoethmoidal recess just above the superior concha. And here we are removing the inferior concha, exposing the inferior meatus, which receive the opening of nasolacrimal duct. Medial wall of the nasal cavity, as we said, it is formed by cartilage and bone. So we have the perpendicular or vertical plate of ethmoid completed by the vomer and anteriorly by the septal cartilage. What is the nerve supply of the nasal cavity? We have two types of nerve supply. أولا olfactory nerves. These olfactory nerves, this is for the sense of smell, حاسة الشم, by the olfactory nerves. Olfactory nerves from the olfactory mucous membrane هيكون nearby the superior concha and the roof of the nose, ascend through the cribriform plate of ethmoid bone to the olfactory bulb. And the ordinary nerves of sensation, يعني الأعصاب اللي هي تكون for pain and touch, feeling of pain, touch and temperature, اللي هي تكون branches of ophthalmic nerve. قاعد نشوفها هنا مثلا septal branch of anterior ethmoidal nerve B1, branches of ophthalmic nerve, و branches of maxillary nerve اللي هي ومنعتها nasopalatine nerve. This is, we can see this is the olfactory mucosa. It is in the upper part of the nasal cavity and roof on the upper part of the nasal septum. From here, the olfactory nerves will pass through the cribriform plate of ethmoid to pass to the olfactory bulb of olfactory nerve. This is the blood supply of the nasal cavity. It is important. It is derived from the branches of ophthalmic artery, maxillary artery, branches of maxillary artery, and we have branches ascending from the facial artery. These are branches from the ophthalmic artery. We have the anterior ethmoidal and posterior ethmoidal arteries, branches of ophthalmic artery. The sphenopalatine artery is a branch of maxillary artery. Septal branch of superior labial artery, which is a branch from the facial artery. And we have greater palatine artery, also branches from greater palatine artery, which is a branch of maxillary artery. All these branches will anastomose in the area of the vestibule, form a plexus, and this plexus is called Kesselbach plexus, or in the area that is called Little's area. We can see that are the branches from the ophthalmic, maxillary, and facial will anastomose in this area that is called Little's area or Kesselbach area. هذه هنا area in the nasal vestibule called Little's area. What is the importance of this is that epistaxis, which is bleeding from the nose, هو الرعاف, it's occurring in this area. It's called Little's area or the Kasselbach plexus. This is the anterior epistaxis, or it might occur a posterior epistaxis, that's from the branch which is called the sphenopalatine artery, branch of maxillary artery. Anterior epistaxis or posterior epistaxis. يعني النزف راح يكون أما يكون أمامي أو يكون خلفي. What is the lymphatic drainage of the nasal cavity? The lymph vessels draining the vestibule will end in the submandibular lymph node, while the remainder of the nasal cavity is drained by the vessels that pass to the upper deep cervical lymph nodes. The paranasal sinuses. These are air-filled cavities that lies within the bones of the skull, within the frontal bone, within the ethmoid, the maxilla, and sphenoid. They are air-filled spaces, يعني هي فراغات موجودة بالعظام. We have two frontal sinuses, and we have ethmoid sinuses, maxillary sinuses, and the sphenoid sinus. These paranasal sinuses are cavities found in the interior of the maxilla, frontal, sphenoid, and ethmoid bones. They are lined with mucoperiosteum, or we can say it's a mucous membrane, filled with air, communicate with the nasal cavity through relatively small apertures. It will communicate with the nasal cavity through the meatus. They reduce the weight, which is the function of paranasal sinuses. الأعتياد راح تقلل لنا الوزن. They reduce the weight of the skull, act as a resonator to the voice, يعني لها علاقة برنين الصوت. When the apertures of the sinuses are blocked, إذا انغلقت عندنا هذه الفتحات اللي تؤدي للنزل cavity, or they become filled with fluid. High sinuses, if it is filled with fluid, the quality of voice is markedly changed. راح تتغير عندنا نوعية الصوت. ليش؟ لأنه قلنا إذا وظيفة مهمة act as resonators to the voice. First, the maxillary sinus, which is the largest one, is a pyramidal shaped space lies below the orbit. Below the orbit, it's related to the lateral nasal wall. It lies within the body of the maxilla, pyramidal in shape, located within the body of the maxilla behind the skin of the cheek. The roof is formed by the floor of the orbit, and the floor is related to the premolar and molar teeth. It opens into the middle meatus of the nose through the hiatus similularis. The frontal sinuses here, باللون السمائي. The frontal sinuses, the two frontal sinuses are contained within the frontal bone. They are separated from each other by a bony septum. يفصلها حاجز. Each sinus is roughly triangular, extending upward above the medial end of the eyebrow and backward into the medial part of the roof of the orbit. Each frontal sinus will open into the middle meatus of the nose through the infundibulum. This is the frontal sinus, will lead to a funnel-shaped channel that's called infundibulum, that it will open into the middle meatus. middle meatus, and the anterior end of the hiatus semilunaris in the middle meatus. The sphenoid sinus, the two sphenoid sinuses lies within the body of the sphenoid. Each sinus will opens into the sphenoethmoidal recess above the superior concha. قاعد نشوف إنه how the superior concha is small. The area above is called sphenoethmoidal recess. It will receive the opening of the sphenoid sinuses. The ethmoid sinuses, here we can see this is the ethmoid bone. It have two lateral masses and a vertical plate of ethmoid, and this is the nasal cavity. هذا الفراغ nasal cavity. The ethmoid air sinuses, we have anterior, middle, and posterior ethmoid sinus. Ethmoid bone will attach posteriorly to the sphenoid bone, and these are the sphenoid sinuses. The ethmoid sinuses are anterior, middle, and posterior. It might be called ethmoid air cell. They are contained within the ethmoid bone. They are situated between the nose and the orbit. Situated between the nose and the orbit. So these are the ethmoid sinuses: the anterior, middle, and posterior. We can see that there is a thin plate of bone. This is a thin plate of bone that separates ethmoid sinuses from the orbit. So the infection can spread from the ethmoid sinuses, if there is a sinusitis, into the orbit. ينتقل الالتهاب من الجيوب إلى الأوربت cavity. نقول أنه anterior ethmoidal cell will drain, anterior ethmoid sinus will drain into the middle meatus. The middle ethmoid sinus will open into the bulla ethmoidalis on the upper border of bulla ethmoidalis, and the posterior ethmoid sinus will opens into the superior meatus. Thank you. Another important note, as we say, they are again ethmoid sinuses are separated from the orbit. هذا هو thin plate of bone. بالتالي راح يكون الانفكشن can readily separate from the sinuses into the orbit. Ethmoid sinuses, the anterior sinuses will open into the infundibulum here, into the infundibulum يعني into the medial meatus, وال middle sinuses will open into the middle meatus or on or above the bulla ethmoidalis. والposterior sinuses will open into the superior meatus. بعدنا بحالة إنه يكون إذا there is a inflammation of the sinuses, we call it sinusitis. There will be collection of fluid and blockage of the drainage, يعني blockage of the meatus. Thank you.